The title is daunting, How the Virus Won. And you really should see this. Abby will send you a URL, or I'll send you a URL. Okay, so let me just read you a little bit of this, and I'm going to go to the whole thing. The thing is long, it's worth watching it. Invisible outbreaks sprang up everywhere. The United States ignored warning signs. We analyzed travel patterns. Look at this. Travel patterns. Exogenous variable. Can't measure directly, measure indirectly. Meaning, does travel patterns determine sickness? No. But travel patterns are very good proxy for how easy is diffusion. And look at this. Can you see New Orleans, Atlanta, New York, and Miami? And the little red dots? I don't know how you can see. Can you see my screen that way? Nelly, are you seeing it? Can you see it?
Yes.
Yes.
Okay. So, okay, and then he's telling how it started. A woman near Seattle had a persistent cough. Woman in Chicago had a fever and shortness of breath. Two first known cases in the US, Seattle and Chicago. Okay, by mid-February, there were only 15 no coronavirus cases with all direct links to China. The 15, within a couple of days, President Trump said there'll be no more corona cases in the United States. Okay, they insulated the patients. Travel from China was restricted. Down. None of that worked. Only a small part of the picture was visible. Some 2,000 hidden infections were already spreading through major cities in the US. They did a retroactive tracking. Can you see my screen? Retroactive tracking. Okay. And then they traced it. How did the virus got in? Say, oh, it came from China. Not really. Not really. It came actually from Europe more than from China. Closing the trips from China didn't limit it. And actually, the reason why New York had it so bad is because New York had it much earlier from Europe. And our governor didn't do too well. Okay, it took him home, the governor and the mayor in New York, took them a long time. We don't only say that President Trump procrastinated. Our governor and our mayor procrastinated big time. The country was unaware of its own epidemic. Many tests released by the CDC, and this is the other thing, for about a month, the CDC wouldn't take the World Health Organization test. They decided to develop their own. Their own didn't work. The chemicals were the wrong chemicals. Also, they kept monopoly of testing. So they didn't, many competent labs, obviously some of them would be hoax too, but many of the labs could have developed tests at that moment and could have industrialized it. And the prices would have gone down, and et cetera, et cetera. And this is actually the estimated infections by March 1st. Look at this. Okay, so that's basically it. Let me see if there's anything else here. Oh, one more thing is they actually, Seattle and New York were the big originators. And basically, and listen to this. Mayor de Blasio on the 2nd of March, I'm encouraging New Yorkers to go on to their lives and get out on the town. This is when already there were thousands of cases all over the United States, some known, some not known. Okay, and then this is really the straw that broke the camel back. People living New York City made about 2.8 million trips to the Hudson Valley. Some carried the virus with them, and outbreaks were accelerated in mid-March. The likely result travel from New York at times analysis. So basically, exogenous variable, number of trips. Okay, I'm going to stop here. If you have the time, look at this. It's appalling. Okay, but we are not alone. This is China. And that I also will give you the link. How the virus go out. The most intensive travel restriction to stop an outbreak in human history haven't been enough. And basically what they looked at that, and they said, it seems simple. Stop travel, stop the virus from spreading around the world. Here's why it didn't work. Many of the first cases were in Wuhan, and they didn't identify this for a while. And they had cases, maybe thousands of cases, and people are still flying out of Wuhan. We actually have PhD student that came back from Wuhan. And look at the frequent exogenous variant. 175,000 people left Wuhan one day. So basically, you can see this is the same story. Spreading. Sometimes they didn't even know that things were happening. When this eye doctor, whatever, Dr. Lee, said when we had this pneumonia going on, there is a new bad virus. He actually was thrown in jail for a couple of days for saying that. He finished up dying from corona. Okay, that's because the politicians don't want this information to go out. They thought they could control it. So this is China. Okay, let's continue here. And you might want to have a look at it. Measurements. Now this measurement. Vice President Mike Pence asserts that increasing testing explains a surge in cases. Is that true? Yes, of course it's true. Test more, you're going to find more diagnosed cases. But that's not what we want. You don't want the immediately diagnosed cases. You want estimates by geography and by time of how many people have been already contaminated. Just testing. And these are the numbers of today. Okay. Cases and deaths in the US. And by the way, if you get the slides, you just click on them, you can go to the articles. Okay, I don't need to send them to you. Total cases in the US, 2.5 million, total deaths 5%. New cases yesterday, 44,508 deaths, 1%. From 5% to 1%. What does that indicate? We are getting better in treating it? No. What does it indicate? Nick, what do you think it indicates, the decrease in percentage of deaths in this particular chart?
I guess I think the decrease could be the increase in testing.
Absolutely. Absolutely. Meaning before the testing, only very, very sick people, a lot of them died. Now the public is much more wary. There is much more testing, although not sufficient. So less people percentage die because people that before were not tested are being tested. So now we are going to change, and you're going to say we're going to come back to this. I want to teach you a little bit about auditing. First, you have to learn a thing called agency theory. Agency theory is something academics do for a long time, and this is applied to audit. So the people that own the company, the stockholders, we call them principals. And then management are the agents. And obviously, the stockholders, if you're a stockholder of Coca-Cola or of Exxon, you know much less about the company than the manager or the information system guys there. So there is a thing called information asymmetry. Now, in order to reduce information asymmetry, and because of Security Act 3334, we created this thing called financial report. It's a measurement of how the agents are doing, how is the company doing. But don't forget that this progressively became less and less meaningful because many variables are not being measured. Okay, and the financial reports are sent to principals. And there is this thing called moral hazard. The agents are paid commissions. Okay, the agents get salaries. If the company does well, they get bonuses. They want corner officers, pretty secretaries, etc., etc. Mr. Inmelt, the past CEO of GE, used to fly around the country in a Boeing one of large Boeing, okay? And you know what he used to do? He used to have a second one follow him. So if the first one had any problem, he flew on the second. But, you know, it's moral hazard. You're spending stockholder money without even thinking. Okay. And then, of course, you pay agents. And there is this thing that progressively became much more important, which is the board of directors. And basically, the board of directors used to be all poodles, meaning, what do I mean poodles? Used to be someone chosen by management that didn't really exert a lot of supervision. Actually, many of the board members were actually parts of the management corps. They were parts of management. Now, that kind of particular for the audit committee and the compensation committee changed. And since Sarbanes-Oxley and even before, many of those board members became independent board members. But the problem is that the nominating committee typically has a lot of management. So they choose people that are not going to fuss. So there is not a lot of very good independent supervision. Also, the other phenomenon, you had guys that were guys like Jeff Bezos or Inmelt that were in many boards of other companies. Since when you are running GE and you have time to supervise 6, 7 other companies? That's kind of changed. They reduced the number of boards that they are on, but still is there. It's kind of scratch your back, scratch my back. Okay, and then this whole idea of, well, if you can't, there is this moral hazard, let's create auditors that will verify if what financial reporting being done is correct. Okay, so these are supposed to be independent people following reporting standards set by the SEC. The only problem with that is that auditors are paid by the client. If they have bad findings, they get fired. So there is a problem with that. So this is what they call the agency view of audit, with the problem of moral hazard, the problem of auditor independence, and this is our current model. Now, other countries like Italy tried automatic rotation of audit firms. They tried designating audit firms by a government committee. There are other things are being tried in Europe beside the United States. In the US, there is already required rotation of audit partners. So you can't be on the same engagement more than 5 years. So after 5 years, you move out and the assistant partner there takes it over, et cetera, et cetera. So there have been some measures of independence. And then there is this concept of materiality, which is a concept of relative error. And basically say, you can't measure perfectly. So it has to be reasonably right. The financial statement opinion says fairly represent. And so I have to fairly represent what is considered fair representation is within 5% of net income. That's not the rule, that's kind of interpretation of the rule. And I already talked about auditor constantly. And then there is this idea of auditor skepticism, that the auditor has to be suspicious what he gets and examine it with a certain degree of skepticism. And independence, as I said, you get hired by the firm. Now, the other thing about audit is basically you think about this like hypothesis testing. You have to imagine that the financial statements are accurate, they are complete. Complete means what? All the transactions were taken in consideration. And the numbers were correct in there. And they actually not only complete, they actually happened. And you need to have in consideration the rights and obligations of the company and how understandable the financial statements cannot be extremely obtuse because that doesn't have the stockholders. And actually the audit finish up being in the standard, this is Lobecki and Evans, or Evans and Lobecki auditing book, and say, well, there are 4 stages in the audit: plan the audit, perform test of controls, perform analytical procedures, and issue an audit report. Those are the 4 stages. And many of you, typically PAMBA, more than half of the students go to Big 4. And then another quarter goes to other firms, and then the other quarter does other things. So you're all going to be, to a certain degree, involved in this. Thing to remember is the agency model. Thing to remember is assertions, and basically the 4 steps of the audit. Now, what's changing is because analytical methods and exogenous variables allow you to measure things in a different way. And that's what you need to start thinking. Okay, and I'm going to skip these things. And I'm going to jump to this slide. This slide basically said, how do you know that all transactions are represented? You pick up a sample and extrapolate to the full population. You have value of these transactions are 1 million, just very simply. They are 1/10 of the transaction, multiplied by 10, you finish up with 10 million as the estimate of revenue. It's very simplistic. These days, you don't even do very much of that. And these days, it's still allowed to take samples, what they call judgmental samples, of 40 items or 20 items. So you have a population of 10 million transactions. You don't really do extrapolations on that, but you check, the control's good on this, and etc. And we did this whole project we call the MADS project, basically to examine the full population. You're going to hear about it in etc. Now we're going back to COVID because now you know what the verification process is. Okay, and so this is what we said here, that probably the number of people that had COVID, and they use this antibody test. What is an antibody test? The antibody test is a test that checks if your body already have fought COVID. The thing that you don't know is for how long that antibodies are still detectable. and the error rate on these tests is high. Okay, and so basically they ran, and what they did, they ran much more than sample of 40. They ran 11,900 clinical specimens, and these clinical specimens were taken not because someone had COVID, but they were taken by people that went to hospitals for many different reasons. Okay, so it wasn't directly related to COVID. When Governor Cuomo ran his tests in New York in the supermarkets, he basically tested 3,000 people just randomly in the supermarket. Here is a little bit different. He tested people that were sick, okay, for some reason were being tested. So it's already a little bit of a biased sample. And we don't know exactly what the bias is, but this is a much, much better measure than counting people that were tested the way things are shown. Okay. And just reading this thing about Missouri, the difference between recorded infections and the actual prevalence of data was highest in Missouri, where about 2.65% of the population was infected with the virus in this particular test as of April 26. Remember, has to be at point in time because things change very rapidly. This number is about 25 times the reported rate. So they are estimating 10 times the rate, but in Missouri was 24 times the rate. Okay, so why is that? Why is it? Because the infection moves. And in some places, it hasn't gone to the 25 days of cycle or the 10 days of cycle, and the infection keeps moving around the United States. So you have, and it's very heterogeneous. Extrapolation in heterogeneous populations is very difficult. And the results confirm what scientists have warned about months, that without wider testing scores, infected people won't detect. Okay, I just want to show you this very rapidly because I'm running out of my time. This is actually from The Economist, and basically calculate the number of deaths. And what they did is calculated in average, you look at these pictures, how many deaths over the last 3 years occurred in that month. And then they put the measurements of months of this year. And the red is the measurement on this year's. And you look at France, there is a big peak in April. In Spain, big peak in April. In Britain, a big peak in May. Netherlands is more like April, May, and et cetera, et cetera. And you note each one of these European countries had a huge surge of deaths. You don't even argue, is it a COVID death or not a COVID death? COVID is a big thing happened at this moment. It's reasonable to attribute the excess deaths to this. Okay, and it's not only Europe. Now, Sweden, you look at the numbers in Sweden, you know what Sweden did? Sweden did not do the preventive measures that other countries did. They basically said that disease is not going to be very bad, do some prevention. And the number per capita of deaths in Sweden is the largest in Europe. And you compare Sweden with Norway and Finland, pretty similar type of countries, the numbers in Sweden are 2 or 3 times higher in per capita death. So obviously, like social distancing and these other measures that we are taking are having an effect. Now, some people argue that these measures only postpone the problem. Well, it's okay to postpone the problem. The hospitals don't get inundated, and maybe we'll have a cure, or maybe we'll have a vaccine reasonably soon. So you're doing the right thing. You're spreading and you're managing the story. And this is like the Economist's excess deaths. And you see how excess death is the deaths that occurred minus the deaths that in average occurred in the past years. Okay, and now when you can't measure directly, you measure indirectly. So this is picture taken from an airplane of a cemetery in Brazil, in Manaus, in the Amazons. And if you count it, and actually the reason people are questioning the number of deaths in China is because they photograph cemeteries and they don't jive with the numbers that the Chinese